Well, a week is a long time in general practice these days. So, for the new updates this week, in the context of rising case numbers of COVID in New South Wales, the sudden increase in social mingling, and the uncertainty surrounding the Omicron variant, the recommendation for booster doses has been brought forward to 5 months. And there's talk about the primary vaccine course being 3 rather than 2 vaccines, as Israel has recently mandated. So, suddenly Pfizer vaccines are in short supply in the weeks leading up to Christmas. Moderna has now been approved as a booster dose, and in the context of demand for Pfizer outstripping supply, we hope to have Moderna also in our practice to fill this shortfall. Things are looking good for us to start administering COVID Pfizer vaccines to our paediatric population aged 5 to 11 from Monday the 10th of January, with our delivery scheduled to arrive the week before that date. I must admit I've been surprised by the number of children in this age group who've expressed to us that they're keen to be protected from COVID like their older sibs and their parents. Although rates of hospitalisation from COVID in this age group are relatively low, COVID still causes severe disease at a rate that is much higher than influenza. Children in this age group do have the highest incidence of so-called PIMS-TS with COVID infection. This is the Pediatric Inflammatory Multisystem Syndrome, temporally related to SARS-CoV-2. It's the hyperinflammatory syndrome that occurs at 2 to 4 weeks following COVID infection and can make children very unwell indeed, requiring ICU management. This age group is much less likely than their teenage counterparts to get myocarditis both in the general community and from the vaccination. And it's for these reasons that the vaccination has been approved as safe and effective in this age group. And as a wanted extra benefit, vaccinating this population will also reduce the amount of circulating virus in the schools and the wider community. You'll be able to book online very shortly, and in the interim you can call our receptionist to book your child in for their first vaccine. The dosing interval will actually follow the UK recommendations with an 8-week interval before the second dose. However, this can be brought forward to 3 weeks like the US under extenuating circumstances such as prior to overseas travel, before starting immunosuppressant medication, and so on. The best way to prepare for the appointment in this age group is to express a positive, upbeat attitude about the benefits of vaccination for your child. The needle's tiny, the dose volume is tiny, and the whole process is so straightforward, but children in this age group can become quite anxious, and they'll look to you and they'll absorb your emotions. We have our systems in place to start vaccinating from the 10th of January, and we're confident that the wider logistical preparations have been made for us to receive our stock in the week before the 10th of January. It's a completely different vaccine, with vials having an orange top as opposed to a purple top. The volume is 0.2 mils as opposed to 0.3 mils. And we have clear processes in place at Walker Street Doctors to ensure that there is no confusion about who gets what vaccine. As has been the case every step of the way, our doctors and our nurse are mandated to complete the specific training modules prior to administering these vaccinations. With regards to Christmas arrangements, our practice will close at midday on Christmas Eve and will reopen on Tuesday morning, the 4th of January at 8 a.m. During the period that we're closed, pharmacies will have continuing emergency arrangements in place that were authorised during the bushfires of 2020, where they're able to dispense regular medication to a patient without a script for up to 1 month until that patient is able to provide it to them. Our hot doc script and referral requests will remain open, and I'll check those once daily during this period. I know that we've got a lot of very overworked patients who need a jolly good break this year, and I hope you're able to take some downtime over the coming month to reset, reassess, and rejuvenate. And I hope this update has been helpful.